Hello, friends. I'm a clinical pharmacist and just want to make a comment about what I saw in the debate between uh, President Biden and the former president. One of the things I saw, and I know President Biden's performance has been was less than expected. But when he walked out, one of the things I say, looks like he's been overdose on and uh, and potentially what it could be was I don't know what he's been taking, but so this is potentially what it could be was you could tell it appeared to me at least that he's had a series of dermatoxins, and because you could tell about when you look at even at his forehead, you can see there was no wrinkles here, but there's wrinkles up in one corner um, that they're trying to get out. You can see that there is some inflammation of the skin a little bit from some skin resurfacing, maybe. I don't know for sure. This is but one of the things that happen with dermotoxins, the most popular, that people know about is the one that starts with a B. I won't mention the name. That sort of take wrinkles out the skin and make people look a little bit younger sometimes. But one of the common side effects, especially if it migrates or if it's close to, it can migrate to the brain, to the nervous system, other parts of the body. Those toxins can. Muscle weakness is a common thing in the elderly. And older people metabolize those things a little bit slower and differently, so it can be an exaggerated effect. So muscle weakness, difficult swallowing dysphagia is called. Respiratory issues. You can tell he had trouble breathing, and um, a drooping eyelid can sometimes occur. And there are periods of time where it looks like there's one eyelid that was drooping a little bit more than other. Um, and you could tell that he didn't look like he could form the expressions like he wanted to. He had sort of like a blank expression sometimes um, that occurred. Uh, Along with fatigue and those sort of things and dry mouth that can occur from that as well. But he had a cold, he said, and so being on a cold, he was likely also on an antihistamine, maybe to help dry the secretions up, um, and maybe a decongestant as well. But those have what's called anticholinergic effects, and what can happen with with the decongestants, and a man of his age is probably maybe also something for for urine flow, which also has a cholinergic effect, or something for memory loss, which also has that effect. So those added effect, adding the antihistamine to it, could create a cognitive decline. These are known effects in the elderly. Confusion. So there's a second drug that can cause confusion. Increased risks of dementia that can occur by taking these medicines. Drowsiness and risk of falls. And we know he's fallen more often lately. So those are some of the things, even from the drug. Now, a third one would be cough suppressant. Uh, so he was, he coughed a few times when he first came up. So cough suppressant is he is likely on to help suppress the cough. And the most common cough suppressant can cause like the muscle rigidity, and you can see he looked kind of rigid and stiff. And also it can cause confusion. Another thing it can cause sometimes is the lip smacking, and someone messaged me and told me that he's smacking his lips, and which can create sort of it looks like Parkinson's syndrome or some other things sometimes, but that's something that can cause from those effects. And even a normal adult dose in a person that's older can have undesired side effects. And so that's just one possibility. In addition to having the viral infection and cold and dehydrated, that can also cause confusion and those things as well. So that may be something that contribute to his less than optimal effect performance. So this is something to think about, and have a good day.